Hi, my name is Hannah Holbrin, and I will be showing you how to properly splint an injury from home. I will be using stuff that you will just see around your house, such as blankets, scarves, belts, whatever you can use. As you can see, I've put my gloves on because when I touch a person that's injured, you don't know if there's any cuts or scrapes or bleeding or drainage, and you don't want to spread any contamination, so I have my gloves on. So as you can see, I have a pretend injured leg here, and I wouldn't just touch the leg, but what I would do is I would take this blanket and I would not move her leg. You don't want to move the injured leg, but I can move the non-injured leg, which is going to be her, what leg is this? Right. Her non-injured leg is her left leg, and I can move this one. So what I'm gonna do is put this blanket across the injury and gently cushion around the injured area. Afterwards, I'm going to take anything that I can use to wrap around that blanket. And for this video, I will be using a scarf and 2 belts. Normally, you would want to be using 4, that's ideal, but I couldn't find 4, so we're going to use this. But what you would do is you would take and push under the leg, and you can ask them to raise that other leg, but try not to raise the other one. That didn't make sense. You can ask them to raise the non-injured leg, but not the injured one. And you want to place the belt where the injured portion of the leg isn't. You wouldn't want to put it directly over where the broken area was. So we're going to put one lower. Can you raise your leg for me? And then after you have them all laid out, then you can start to tie or buckle them together. And you want to make sure when you tie or buckle them, can you raise this leg for me? Push this under. That the knot is above and that it is not directly on top of the injured area. And the entire time that you're doing this, you would be talking to your patient and explaining what you are doing and how, oh, I did that backwards. This is going to help them. So then after you have it all together, you would want to check their feet. And you're checking their feet because you want to see if it's cold, if their toes have turned blue, because if it is, that means that there's been a loss of blood circulation in their legs, and you wouldn't want that. If that happens, then you would want to undo all your wrapped bandages or your splint and readjust everything and loosen it to where that blood flow can go through. And after, let's say everything's good and done, you would leave them sitting there in that position and you would assist them until EMS arrived. And once they did, you can dispose of your gloves properly, and you would put these in a biohazard bag, trash can, Ziploc bag, and that's how you splint an injury.